I'm following up on the previous discussion about emergency room evaluations. So, I recently saw a patient, maybe yesterday. She was a 19-year-old female who is at Elon University. She was a second year student, and she was staying at the dorm, single bedroom. She doesn't have any roommates, and her family is in Boston. She has parents and an older brother. What happened was that she went to her advisor with a report of being very depressed for several days, not getting out of bed for several days, and having thoughts such as, I don't want to live. She said that she didn't have any suicidal thoughts as such or suicidal plans as such, um, mainly very depressed. She talked about how she doesn't have any friends. She talked about how she doesn't go to the cafeteria because she feels ashamed that she doesn't have friends. She had some challenges with eating disorder symptoms in the past. She's not binging or purging, but mainly not eating that much. So, mainly avoidant type. Um, and so she went to the advisor, she was sent to the counselor from the advisor, and then was sent to emergency room for further evaluation. Patient was extremely tearful during the interview, and she didn't want to be admitted to the hospital. And um, she continued to say that she's not suicidal. She was very anxious, but continued to say that I don't want to live anymore. We did admit this patient to the inpatient on an IVC basis. The reason for that is that when you are evaluating such a case, you want to think about the protective factors, and you want to look at like risk factors. Risk factors here are that she lives in a dorm by herself. She doesn't have any friends. She has had significant thoughts of not wanting to live. And then uh, she doesn't have good relationship with family. Means like family is there in Boston, but she doesn't have good relationship with the family. And she doesn't have significant other or boyfriend also. And she's not doing well in school, not doing well in school. So protective factors wise, she doesn't have any medical issues. She doesn't have any previous suicidal attempts. She's never been hospitalized. Um, so she has financial support from her family. So in this case, like if you see, as your question was that what should I do if there was an impulsive episode, um, and then the patient and family wants no admission. There is no impulsive episode here, but I'm using this example to explain that even though this patient doesn't have an active suicidal plan, even though this patient has no previous history of it, the risk factors which are there as listed here are so significant that a lower level of care is not prudent here. Because let's say that we discharge this patient, um, she doesn't have much support at all. So this is not acceptable in this case. So similar in that, if like there is an impulsive suicidal attempt and family is also supportive that she can be discharged, your goal is to list out the protective factors and the risk factors and then make a decision. But if the risk factors are significant, then you can go against the family and IVC the patient. But you want to collaboratively discuss with the family and educate why you think so. I hope that helps.